Yeah, Mama Nurse Worldwide Health Tip on cough. I want to specifically give you care and treatment on cough now. And I think for now, this will be the last video I will do on cough. So please share, comment and like my video so that the industry will grow. The health tip industry will grow. Now, care and treatment of cough. If your cough is caused by infection, definitely your healthcare provider will give you antibiotic or antiviral medication. But most viral coughs don't require antiviral medications. For what we call GERD, G-E-R-D, capital, they might suggest diet changes or prescribe a proton pump inhibitor or an H2 blocker. Well, all what I'm saying, you may say I'm too medical. No. When I say something and you don't understand, put it on comment section. I will elaborate more on it. So water, I've said, is also good for cough. It eases throat irritation or dryness. Adding it to the hair with vaporizer or streamer. Shower are other ways water relieves a cough. You go under shower, you shower. But for those that smoking of any type cause their cough, you need to quit smoking. If you don't quit smoking, you will still continue to cough. And avoid other irritants. Anything that will irritate you, please avoid it. Irritants. What are irritants? It might be perfume. It might be candle smoke or anything that you are allergic to. Please do away from it. Your over-the-counter medications. Over-the-counter medications, you need to be careful. That is where this my going against self-medication comes out again in this video. All these cough syrup, minor cough syrup, which includes honey and maybe some menthol and all those ones are still okay. But when you go to higher something, you need to watch it. Pure honey, real pure honey is good. It's good. It's very, very good. Sore throat soothes. We have different types. I'm not advertising any medication. That's why I'm not mentioning name. Sore throat soothes. We have many of it. It's good. Hot beverages with pure honey. Tea with pure honey is good. Child of under 6 years should not be given cough medicines unless with approval of health care provider. If your child is under 6 years, please don't give any cough medicine unless if it is approved by health care provider. But we always say prevention is better than cure. You can prevent cough. The only type of cough that you cannot prevent is if it's irritant cough. If something irritates you, you may just cough, and that one you may not be able to prevent. But causes of cough can be prevented. Okay, like if you are vaccinated for influenza, definitely you cannot you cannot have influenza cough. If you are vaccinated for COVID-19, you cannot have a problem of coughing that will be attached to COVID-19. If you are vaccinated to prevent pneumonia, you will not have that attack. Avoiding people that are ill. If you know how to avoid people that are ill, what I mean is like somebody that is having tuberculosis, you need to avoid people that can cover and they will not cover their mouth. Avoid them. You are in a car or a public transport, somebody is coughing and that person is not covering up. You may say it and the person may be annoyed. You just cover yourself. And cover yourself for such a person. Hygiene. Wash your hand often with soap, water, and using hand sanitizer. It helps in prevention. You have a cough that you have symptoms of such like whooping cough, wheezing. That means wheezing noise when you breathe out. You need to call doctor. You need to go and see your health provider. If you have fever, over 101.5 degree Fahrenheit that lasts more than a day or two, see doctor because you may start coughing with it. If you have chills, please see your health care provider. At times when you feel like you are choking, please see your health care provider. If you cannot breathe well, see your health care provider. Some people will be coughing and lots of blood will be coming out. You need to see your health care provider. Don't say that you will treat yourself or you just go to somewhere and buy over-the-counter medication and you have coughed, you have seen blood. Go and see your health care provider. When you are coughing and you are having severe chest pain, please see your health care provider. If you are coughing and you are having severe pain in your chest, see your health care provider. You must know that something serious is happening. When you are with your health care provider, you ask you so many questions. Do you smoke? Which type of medication have you been taking? Do you How long have you been coughing? How well you breathe when you are resting and when you are working hard? Does the cough keeps you serious? Does the cough get more serious when you are sleeping, or do you sleep well? Does anything comes up when you cough, like blood or sputum, mucus? You can call it splinging, PHLEGM. Those are the questions you are likely to come across, and please, you will answer honestly. Answer. If you are not honest with your healthcare provider, you are not being honest to yourself. Any medicine that you have been taking, relate it. Do you have bad taste in your mouth? Tell your healthcare provider. Do you have bad breath that will not go away in some time immemorial? Tell your healthcare provider. At times, some people, since they have started coughing, they'll be losing weight. If you are the type that have been going for treatment, weight gaining will show, weight losing will show, because your weight will be taken and will be recorded. So all these things, they are necessary. And once you go about all the advice that Mama Nurse Worldwide gives you on health tip about coughing, you are good to go. Please share, like, and comment. Good day. Till another time. This is rounding up about cough health tip. Any comments, meet me in comments section. I will give you answer. Thank you. Bye. Happy new month. Happy new month. Many more in Jesus, in Allah, in everything in the world. Amen.